Hi everyone, and welcome to your OBGYN rotation. I'm going to begin by telling you a story. A few years ago, I went to Cairo in order to visit family. It is an amazing city, but one of the things I noticed was that there weren't any street signs and traffic was horrible. We were looking for a mosque, the Ibn Tulum Mosque. Despite having someone with us who was fluent in Arabic, we could not find our destination. We would stop and ask for directions, but kind, hospitable Egyptians again and again gave us directions to the wrong place. It is part of their culture to be helpful, even if they don't know how to help. You too are traveling through some uncharted territory in the next 4 weeks. You want to be helpful, but don't yet know how. In this video, we're going to review the goals of the rotations, your responsibilities, the grading system, where you need to be, the schedule, and I will also give you a few tips on how to be a stranger in a strange land. Also, included on your Canvas website is a passport, a guide for tips and tricks so that the next 4 weeks will go smoothly for you. Goals. The American College of OBGYN has goals, the College of Medicine has goals, and as your clerkship director, I also have a few goals. First, let's talk about the ACOG goals. ACOG would like you to construct an OBGYN history, focusing on the laboring pregnant patient and gynecologic patients. They also want you to create a differential diagnosis and treatment plan for common OBGYN disorders. Examples might include cervical cytology issues, contraception, and acute abdomen. They want you to take a sexual history. They want you to be familiar with reproductive cancers, obstetrical problems, and vaginal disorders, including sexually transmitted diseases. They want you to understand the requirements for the health and well-being of women. And they want you to have a basic knowledge of fetal development. The objectives for the College of Medicine should be very familiar to you. They're listed in the syllabus, printed on your evaluation cards, and even posted in Labor Hall for your reference. Let's see if you can name one of them. Could you think of one? How about taking a history, doing a physical, creating a diagnostic or treatment plan, acting in a professional manner? All of these are College of Medicine goals. But as your clerkship director, I also have my own goals. One of the things that I hope you learn in the next 4 weeks is how the physiology of pregnancy makes things different. For example, pregnancy lowers creatinine. So if you see a creatinine in a pregnant person of 1.1, that's actually an abnormal result. I also hope that you don't punish a patient because she's pregnant. An example of this would be not performing an indicated and safe procedure because she's pregnant, or not doing dental care because you didn't know if you could do dental x-rays on a pregnant person. And lastly, I hope that you appreciate what we actually do as OBGYNs. When to consult us and when not to. When to do a pelvic exam and when not to. If you were getting ready to travel to a foreign place, you might want to learn the language before you go. As OBGYNs, we do have a vernacular and lingo that are unique in our hospital setting. OBGYNs love their abbreviations. We are one of the few doctors that use G's and P's. G stands for gravida, so a gravida 3 means she's had 3 pregnancies. P0202 means that she's had no full-term pregnancies, 2 preterm pregnancies, 0 miscarriages, and 2 living children. And because she's a gravida 3, she must be pregnant again. 34 and 2 means that she's currently 34 weeks and 2 days pregnant, with a normal term pregnancy being 40 weeks. We use abbreviations for all of our cervical exams as well. So saying that someone is 450 and -2 means that she's 4 centimeters dilated, 50% effaced or thinned out, and -2 station. If you have questions about dilation, effacement, station, normal or abnormal labor, please refer to the lecture that's on your Canvas. It's a PowerPoint that has audio attached for your review at any time. Some abbreviations are pronounced. For example, premature, rupture of membranes, or PROM, we might call it PROM, but we never call it PROM. CC? Nope, that's one we wouldn't say either. Instead, we would say she's complete. The first C means that she's completely dilated to 10 centimeters. The second C means that she's completely effaced at 100%. And +1 means that her fetal presenting part is 1 centimeter below the ischial spines. And all of this means it's time to push. Some of our abbreviations are redundant, and so we have an estimated due date and an estimated date of confinement, and both of these might be based on her LMP, her last menstrual period. Lab results show up like a bunch of letters all strung in a row. A positive, rubella immune, syphilis non-reactive, hepatitis B non-reactive, hepatitis C positive, HIV negative, and her 1-hour glucose tolerance test was normal at 68. This means she passed and does not have gestational diabetes. Preeclampsia labs are written in the order that they are listed in the computer. The first number is creatinine, followed by uric acid, AST, alk-phos, and ALT. Some of the abbreviations might not make sense. Can you guess what PPBC stands for? Postpartum birth control. ANCS? Antenatal is one word, but it stands for antenatal corticosteroids. Advanced maternal age or against medical advice? Well, depends on the context. The necessary talk about grades. If you were the clerkship director, what would you base the grades on? I think most would agree that your grade should be based on your clinical performance on the wards. And most would want to have some kind of grade based on a test of their knowledge. But here's where the problem comes in. We have one of the shortest OBGYN clerkships in the country, 4 weeks. I don't want all of your grade to be based on a test where your scores are being compared to a national average. We want to make sure that your grade reflects other work that you are doing. So what else could we put in the grade? Our solution was to reward you for what you're already doing. We know that most medical students use a question bank in order to study. So let's attach a grade to it, an easy grade. At the same time, we will be assigning you questions from the Association for Professors of Gynecology and Obstetrics, APGO. You'll hear us refer to this as APGO questions or UWISE questions. This is a bank of approximately 600 questions that will be made available to you through an email link. The clerkship will be sending out this email very soon. Every week, we will want you to complete a set of questions. If you're on OB that week, you'll do the OB questions. If you're on GYN, you'll do the GYN questions. Your first set of questions will be due next Monday at 5 o'clock. We are strict about the time, but after all, these are easy points for your grade. The questions will be pass-fail. If you get 70% right, then you've passed that week's test. The questions are all open book, and you can do them together as a group, or you can do them individually. You can do them in between patients. Do them while you're sitting on labor hall, or you can just get them all over with and do them all tonight. Whatever you do, don't forget about them. 15% of your grade does count on it. The last week of the clerkship, you will have a 100-question timed test. It's still open book, and it's still pass-fail. You'll have to get 70% right within the time allotted. This grade is all or nothing. 15% for all the question bank or a 0. Some people really like the APGO questions and say it's a good method of studying for them. Other people prefer UWorld and the explanations that come with the questions there. I personally think the APGO questions are a little bit more detailed, which leads to more studying, and I like that. We also included some points in your grade for completing your required clinical experiences case log. We know you're doing these activities, so let's give you credit for the work that you do. We will be assigning 5% of your grade for professionalism. These points will be automatically given if you demonstrate professional behavior to the standards of the College of Medicine. Examples of why some people have lost points in the past include missing shifts without excuses, being persistently late, not completing rounding duties assigned by a resident, and even showing up in workout clothing to a departmental rounds with the chairman. Each week is worth 1 professional point of your final grade. How are you going to learn all of this new material? It's been a while since you had reproductive health. You can refer to textbooks such as case files or Beckman's, but most students are using online resources. We will have didactics every week on Tuesdays from 9 to 12. In order to prepare for these didactic sessions, which will be in a flipped classroom style, you will be asked to watch videos produced by APCO. The link to these videos is available on Canvas, and although you'll be assigned videos weekly, you may want to go ahead and knock out a bunch of them now. During the didactic session, you will be given a brief quiz that will also be a part of your grade. You are required to complete 3 out of 4 quizzes. Your lowest quiz can be dropped. Or if you're on night shift and you can't attend a quiz session, you can drop that quiz. Details of how to do the quizzes, how to do the APCO questions, how to get access to the videos will all be sent out in emails or available on campus. 1 point of your grade will be for the midpoint evaluation. This is mandatory and not negotiable. It's a requirement of the College of Medicine. You'll have to bring a completed card with you to the midpoint evaluation. This is a 2-sided card. On one side is a direct observation form for history and physical. This can be done on 2 separate patients, a history on one and a physical on another, if that's easier for you. On the other side of the card is an evaluation that is the exact same format as your official evaluations for the rest of the clerkship. This will give you an idea of what the residents and attendings will be looking for in your performance. Again, you will bring this card with you to the midpoint evaluation with both sides completed by your evaluator. Our clerkship is very short, and so therefore the midpoint will be sneaking up on us soon. I highly recommend that you fill out your cards as soon as possible. This also shows your residents and attendings that you have skills and abilities, so they'll give you some more autonomy on the floor. The sooner the better. All of our grades are dependent upon a time schedule, and this is not negotiable either. The questions are due Mondays, 5 o'clock sharp. Quizzes are open Tuesday mornings until noon. Even if conference runs over, they're still due at noon. Case logs are due at 4:30 Eastern Standard Time on the last day before the shelf. I'd like to give you a few pointers about how to get good evaluations from residents. And perhaps the best way to do this is to describe a student that I've loved in the past. I had one student who got nauseous at the sight of blood. She had to break out of more than one procedure due to feeling queasy. But this student was also the most prepared of all her colleagues. She was the one who always knew about her patients, their diagnoses, their treatment plans. She read about the patients the night before she went to clinic so that her time in clinic could be well spent. She was the one who would help position the patient for surgery. She'd help push the bed when we were moving the patient down the hall. She would bring ice chips to the patient and refill the patient's water bottles. She got extra blankets for them whenever they were chilly. She asked what flavor Jell-O she wanted when she could have clear liquids. Anything that needed to be done, this student did it. She had an amazing gift for being able to read the room and notice where she could be of the most help. She had a strong knowledge base, but most of all, she had a strong attitude. She was capable. She always had a smile. I knew that she didn't want to go into OBGYN, way too much surgery for her, but I also knew that she would be an outstanding physician who would attend to her patients to the best of her ability. Isn't that what we all want? Okay, enough about grades. What about the schedule? Where do you go? What do you do? You will be given an individual schedule which will spell out your responsibilities for each week. One of the things that you'll need to do as soon as possible is to reach out by email to the chief resident on the first assigned service. I can give you an estimate of where you need to go and an estimate of what time you'll need to be there, but you're going to be answering to the chief resident, so it's important to touch base with them and meet their expectations. They will tell you what time you need to show up and exactly where you need to meet. Most of our services are filled with very busy residents. One of the ways to win them over is to simply ask how you can be helpful. Be proactive with your education. Aggressively seek out learning opportunities. Let me give you some examples. If you want to go into radiology, then ask the residents if you can be the one to ultrasound a patient on admission to see if the baby is in cephalic presentation. If you want to do emergency medicine, ask if you can spend the day working in triage. You will spend 1 week on each of our services. 1 on labor hall, a week on GYN, a week on oncology, and a week in clinic. Every Monday, your APCO questions will be due at 5 o'clock. Every Tuesday, there's a didactic session starting with grand rounds at 8 o'clock until 9, and then from 9 to 12, you'll have a protected time to be in a flipped classroom setting. What if your service, where you are for the week, isn't busy at all? Spend your time wisely. Go do an APCO question or two in between patients. Look up things on UpToDate on your phone, or watch a quick YouTube video. Listen to a podcast. And if the day is quiet, well then ask if you can go into a study room and study. If the day is really quiet, then the resident may dismiss you and tell you can go home. Go. Study time is too important. Another common question is, what do you wear? You may be familiar with the New England Journal of Medicine study, which showed that patients prefer surgeons to wear scrubs with a white coat. Well, in labor hall, you can skip the white coat. Most of us wear business attire with a white coat while we are in clinic. Another thing that OBGYNs do differently here in the hospital is we have a different charting system. In AEHR, there's a section that says prenatal. If you click on that section, however, it's not an area where you can actually do any charting. This is a PDF form that is created from previous charting. It's good for reference, but you can't actually write anything on it. The form that you want to look for is located on the bottom of the screen. There's a tab that says prenatal, and when you click on this, it brings you to another section of all scripts. This section allows you to chart on the prenatal record itself. When you initially log into this section, you may have to use a separate password, capital P for prenatal 01. If this password doesn't work, or if you have other questions about logging in, please contact the computer help desk and reference access to all scripts prenatal record. The next 4 weeks will go by very quickly. We really hope that you enjoy your time with us. No matter what you want to do for your career, pediatrics, emergency medicine, internal medicine, addiction medicine, psychiatry, surgery, primary care, no matter what you want to do, we have a little bit of everything here in OBGYN. We hope you get a taste of what we do for a living and come back to visit us soon.